Hi, this is In Your Interest. I'm Dave Porello. Our topic today is alopecia, and this is an umbrella term used to describe a condition that can be loss of patches of hair, or it could range to complete and total loss of hair throughout the body. My guest in the studio is a dermatologist, Dr. Ted Daly of Great Neck, New York, and thank you for joining us, Dr. Daly. I'm sure many of our viewers are familiar with alopecia, or they may have it to a degree or know someone who has it. What exactly is this condition?
Alopecia is hair loss, just a Latin root for hair loss. The disease that I wanted to speak about is called alopecia areata, that being areas of hair loss. It's different altogether from male pattern hair loss or normal balding, like I have a little bit of right here. It's a disease that affects about 1% of the population, about 2 million people at one time.
2 million people.
2 million people. And usually it starts with small patches of hair loss, and most of the time it ends up clearing up by itself within 6 months, a year or so. But there are other people where this alopecia areata extends to the whole scalp and the whole body.
I understand the degrees of alopecia have different names. Would you describe those, please?
Alopecia totalis is all on the scalp area where all the hair loss occurs. Alopecia areata, again, is the small little patch. Alopecia universalis is when you lose hair all over the body, all hair altogether.
Doctor, what's the trigger for this? Can it happen to anyone?
It can happen to anybody. About 20% of people have a family history of this hair loss. It's thought to be an autoimmune process, which means you attack your own hair cells. You're allergic in a way to your own hair. It's similar to in diabetes, where you attack your own pancreas and cause diabetes. Or other diseases, sometimes you attack your thyroid, your own immune cells attack it. Well, in this, it attacks your hair. What causes it is unknown. Stress seems to play some part. It's really unclear as to what role that plays. And once it starts, usually within a year or so, 50% of the people have hair regrowth. 5 years or so, about 3/4 of them have the hair grow back. But there is a small percentage, maybe 10% or so, that continue to have hair loss and can be very extensive.
Doctor, what are the personal and medical complications of this condition? Our hair serves a purpose, so what are the medical implications of losing hair?
First of all, it is emotionally devastating. We spend a lot of time grooming ourselves, making sure our hair is right, tinting it, coloring it. When you don't have any hair at all, or you don't have any eyebrows or eyelashes, it causes emotionally devastating problems just in terms of your going out in daily life. Second of all, as far as the actual physical problems associated with it, if you have no eyelashes or eyebrows, oftentimes the dust can come into your eyes without you getting triggered before it touches your eyelashes. That can be a problem. But I think the biggest thing is the emotional devastation that this causes.
Does research hold a promise for a remedy?
Well, it's been looked at for many, many years is to find out exactly what triggers it. I think that in the near future, let us say in the next decade or so, I think there will be a lot more knowledge about this disease, particularly because of minoxidil and other hair loss. The main thing is that you can inject it. There are different treatments for it, injecting it with cortisone, treating it with anthralin, a type of tar solution, and with proper diagnosis and proper treatment, many times it can be helped.
Thank you, Dr. Daly. We'll find out more about alopecia and some treatments for this condition in the next segment of In Your Interest. Be sure to join us. Hi, this is In Your Interest. I'm Dave Porello. Our topic today is alopecia, and this is a term describing hair loss ranging from small patches of hair to complete loss of hair all over the body. In a previous segment of In Your Interest, my guest, dermatologist Ted Daly of Great Neck, explained that in alopecia, the body has an allergic reaction to its own hair and then rejects it. He told us an estimated 2 million people throughout the United States have varying degrees of alopecia, and there is a hereditary link in about 20% of those cases. Welcome, Dr. Daly. I'd like to thank you for joining us in Your Interest. And I'd like to begin this conversation by asking what can be done to short-circuit a body's allergic reaction to its own hair?
Most commonly is injections of steroids, corticosteroids. And this oftentimes is very helpful, helps the hair to grow back quickly. Again, sometimes the hair can fall out without continued injections, and the individual cases you have to weigh and see what reaction that they have to the treatment. Other things are called anthralin. It's a type of tar. It's kind of a nice cream. It's not like road tar. And put it on the scalp and leave it on there. And that over a period of 4 months or so, then you can evaluate to see if the hair growth has recurred. In a high percentage of patients, oftentimes the hair regrowth occurs with this anthralin treatment, in addition to or separate from using the corticosteroids. Other things are PUVA, which is Sorolin, a type of drug that you take by mouth, and then ultraviolet light, type A, that's used. Minoxidil is another drug that's sometimes used. The problem with all of these is that many times when you have more treatments, many different treatments for one disease, it means that they all don't work very well, and that's the case here. Many of them will work on a patient early on, and then there are other patients who have progression of disease, they have more hair loss, and there are other more dangerous treatments, such as the PUVA. Sometimes with the Sorolin you can have liver damage with taking those pills, as well as other treatments that are oftentimes not very helpful.
Doctor, our guests frequently warn our viewers about unscrupulous people who have so-called remedies for arthritis, cancer, and other conditions. Do quacks prey on people with alopecia? And if so, what do you tell your clients as a warning?
I think number one, they have to have it diagnosed by a dermatologist or a medical doctor. I think for them to treat this on their own is a waste of money and time. There are many different other causes of hair loss other than alopecia areata, and those should be evaluated first. People who have this disease, kids particularly, can have thyroid disease with it, and they should be evaluated for that. And sometimes adults can also have those problems. I think that they need to have it diagnosed and treated, I think, by the mainstream medicine. I think for them to buy any of the other formulas that are touted on TV as great hair loss remedies, I would say that this is a waste of their money at first, and that they should at least have it correctly diagnosed.
And very briefly, Doctor, we have about a half minute. Is there any other physical complication that alopecia can bring along, or is it just completely
well,
just
other than the thyroid disease, and that's about 25% of children can have thyroid problems along with it. There are also other associated autoimmune diseases, such as where they have eczema, where you can have lightening of the skin called vitiligo, and other diseases where you attack other organs in your body.